Thank you for joining our coffee break webinar. Testicular germ cell tumors represent the most common malignancy in men between 20 and 40 years of age. While cisplatin-based chemotherapy has been a highly effective therapeutic approach, about 5 to 15% of patients develop recurrent chemo-resistant malignancies. In this coffee break webinar, Dr. Kucerova discusses her translational research into novel combination treatments of cisplatin-resistant testicular germ cell tumors. Dr. Lucia Kucerova completed her PhD at Comenius University, where she studied the exploitation of cellular therapies in the treatment of solid tumors and the role of the tumor microenvironment in chemoresistance. In her current role at the Comenius University Medical Faculty and Cancer Research Institute of Biomedical Research Center in Bratislava, she is investigating novel combination treatments to treat refractory testicular germ cell tumors.
Good morning, everybody. Thank you very much for the introduction. And I would like to show you how we at the Translational Research Unit execute our translational research. We are trying to apply basic research into clinical practice, and we also work on the solutions, how to experimentally and experimental approaches used to solve some clinical questions. We are focusing on the overcoming chemoresistance to cisplatin in testicular germ cell tumors, and this is a research focus of the Translational Research Unit for over 10 years. As you know, platinum-based chemotherapy is prescribed to many cancer patients. It's 10 to 20% of different types of cancer which are being treated with cisplatin regimen. However, there are multiple mechanisms how the cells acquire cisplatin resistance, and they are either pre-target, on-target, post-target, or some other types of cell cycle arrest, autophagy, or microenvironment which enable the cancer cells to escape the cisplatin chemotherapy toxicity. It still remains challenging to overcome acquired resistance to chemotherapy, and perhaps you know that testicular germ cell tumors are exceptionally sensitive to this type of chemo. However, some patients recur with the chemo-resistant disease, and we are trying to find approaches either for single therapy, monotherapy, or combination therapy to achieve some amelioration or overcoming resistance or refractoriness of these types of tumors in preclinical setting and in clinical studies. So far, it's been achieved with limited success, so that's why we are trying to test new compounds and new combination of compounds to achieve our goal. What I would like to show you that we use actually multiple model cell lines, even though this disease is a rare cancer. There are multiple cell lines available, and we have derived our own models of acquired cisplatin resistance, so we can actually test our hypothesis on all histological subtypes of the testicular germ cell tumors. Now, in order to find new drug combinations, we have performed high-throughput screening. We have tested 24 different compounds, which are already at the clinical stage. And then we test these compounds in several different concentrations, either in monotherapy or combination with cisplatin, with the idea that we could achieve either additive or synergistic effect of these compounds to kill the cancer cells. And as a next step, we use different platforms to actually validate the results of high-throughput screening, one of them being real-time impedance platform. The major advantage of this platform is its rapid implementation, because it's a label-free method. It's suitable for our adherent cells. And as you can see, it can be actually multiplexed with endpoint luminescent measurement of relative viability. We combine these methods also with kinetic real-time luminescence measurement independently, and also where we have specifically labeled cells with a nuclear fluorescent label, we can use real-time image-based analysis and combine it with the endpoint luminescent analysis in order to confirm the additive or synergistic effect of the selected drugs. As you can see here on this example, very quickly we were able to implement impedance-based evaluation of cisplatin cytotoxicity. This is just an illustration that we could use our ovarian yolk sac tumor cell line directly in the impedance-based platform, showing really nicely the growth curve over 72 hours and inhibitory effect as demonstrated by decrease in impedance by various concentrations of cisplatin. And you can see on the right hand side that actually the results can be exported either as impedance and decrease of impedance, or they can be calculated as a percent of cytolysis, as you can see on the right on the lower panel, where you can see that actually by this method we can confirm the IC50 for cisplatin for this cell line being about 1.6 microgram per milliliter of cisplatin, which really nicely corresponds to the viability data achieved and by the relative viability measured as a luminescent readout. I would like to show you that impedance-based platform helps us to overcome some difficulties which we have observed with our cell lines which are not suitable for image-based analysis. Such an example is the cell line representative of seminoma. It's broadly used as a model of testicular cancer. However, as you can see on the images, the cells are very transparent, very low fluorescent label and intensity can be observed in the images. So that's why the readout is not really reliable when you want to determine the sensitivity. However, when we took these cells to the impedance-based platform, the resistance is very nice and the proliferation is really obvious here as a really nice increase in impedance. And also we were able to see very nicely very quick effect of the inhibitor of HSP90 at the various concentrations, and we can see that this cell line, for example, is very sensitive to monotherapy with this inhibitor, and the combination therapy did not really increase the efficacy of cytotoxicity. So we actually think that this type of treatment is suitable to be used in monotherapy. I'd like to show you the combinations. We have used small molecular inhibitor in combination with cisplatin. In this case, we have chosen the representative cell line for embryonal carcinoma, and this is a chemo-resistant variant. And as you can see, the increasing concentration of small molecular inhibitor decreases the viability of the cells and increases the cytolysis, as you can see by the increasing intensity of the yellow, and increasing concentration of cisplatin again also decreases viability, but the combination of the two, as you can see on the right hand side lower part, is really cytotoxic, and we can see that the combination of these two compounds is really highly efficient in inducing very strong cytolysis in this chemo-resistant cell line representative of embryonal carcinoma. In conclusion, I would like to mention that we are combining 3 different methods to validate cytotoxic effect of our drug candidates. We use 3 different platforms and combine these in order to confirm which combinations are suitable for further preclinical testing and evaluation in next steps. And thank you very much for your attention.
And that is the conclusion for today's Coffee Break webinar. If you have any questions you would like to ask regarding the research presented, or if you are interested in presenting your own research with microelectrode array technology or impedance-based assays, please forward them to coffeebreak@axionbio.com. Thank you for joining today's Coffee Break webinar, and we look forward to seeing you again.